Hi all, welcome to Edgewiz Academy. This is an exclusive question discussion session for Oman Pearson Vue exam. Edgewiz Academy provides online and offline classes for nurses who are preparing for licensing exams like DHA, DOH, MOH, and Prometrics. It's an online application program which includes several features like premium video classes, premium questions, exam sessions, materials and video discussions and so on. To know more about our classes, please contact us directly. So without wasting any time, let's go to the question discussion session. Okay. So the first question is, a doctor orders 30 mg morphine for a post-op patient. What should the nurse do? Okay. Option A is clarify the order from the doctor. B is give the patient the medication in a split dose after 12 hours. Administer the full dose as prescribed. Document and monitor vital signs after administration. So the key point in the question is, what you have to look for is, it's a post-operative patient, and the question is regarding morphine, which has to be administered 30 mg. So doctor order is mentioned that 30 mg morphine to be given for a post-operative patient. So what must we do? That is the question. So first of all, it's an opioid analgesics, and secondly, most importantly, the patient is post-operative. So what we have to understand is that what is the amount of morphine that should be given to a post-operative patient. Okay, so usually morphine that should be given for a post-op patient is 2 to 4 mg every 2 to 4 hours. Though oral opioid, which the dose is 10 to 30 mg, that depends upon the tolerance of the patient, because oral opioid analgesics is given to a patient who should be conscious. That is the key point there regarding oral opioid analgesics. That too depends on the tolerance of the patient. So here the main point is patient is post-operative and the order dose is 30 mg, which is too high for the patient. So the option first one is the correct answer. You should clarify the order from the doctor. You should say that the patient is post-operative. So are you sure, or you should check with the doctor whether the order is correct or not. Okay. If you see the other three options, coming to the point, option B, give the patient the medication in a split dose after 12 hours. So as a nurse, you cannot split a dose of a particular of any drug unless given the order given by the doctor. The nurse has no right to split the dose of any drug unless prescribed by the doctor. So that's why option B is wrong. And second, administer the full dose as prescribed. That is also wrong answer, because we already mentioned that the prescribed dose ordered by the doctor is already high, which is usually given as oral opioids. That too depends on the tolerance of the patient. Okay. And so C is also wrong. Document and monitor vital signs after administration. So the last three options clearly mentions about giving the dose. One is by giving the dose in split, by splitting the dose. Second is administer the full dose, and third is give the dose and monitor the vital signs. So that's why I said in the starting itself, the dose prescribed here is high. See, so the usual morphine dose, which is IV dose, which is given is, since the patient is post-op, mostly the drugs are given through IV, which is 2 to 4 mg every 2 to 4 hours. Though oral drugs are given 10 to 30 mg every 4 hours, that depends on the tolerance level of the patient. So for that, patient has to be conscious. That is the highlight point in case of oral opioids. So, by considering all these, the answer here is the first one, clarify the order from the doctor. Okay. And second question, the health directorate discusses with the head nurses about using two male wards for COVID 19 patients. What type of organization is this? Options are A. Autocratic, B. Bureaucratic, C. Transformational, and D. Transactional. So while seeing this option, before coming to the question, we should see the options. All these options are regarding the leaderships, the type of leadership. Okay. Now coming to the question, the health directorate discusses with the head nurses about using two meal wards for COVID-19 persons, COVID-19 patients. So what type of organization is this? Okay. So options are autocratic, bureaucratic, transformational, and transactional. So coming to the options, first one is autocratic. So what is autocratic leadership, or what is autocratic type of leadership means? Autocratic In autocratic leadership, the leader himself decides everything without even consulting with their subordinates. Okay, so there will only be one person who makes decision, and subordinates are not involved in the decision making. But here in the question, it is clearly mentioned that the health directorate discusses with the head nurses. So subordinates are involved in decision making, and hence autocratic organization is the wrong answer. Okay. And second is bureaucratic. Bureaucratic leadership. Bureaucratic leader is a person who always sticks on to the organizational policies. No matter what the emergency situation is, he cannot be deviated from his policies, which is to stick on to the organizational rules and regulations. Okay. So here, that too does not belong to the criteria which is mentioned in the question. Here, the health director is discussing with the head nurses as it is COVID 19. The directorate is discussing with the head nurses about using two male wards for the COVID 19 patients. So, he is liberal, he is asking suggestion with the head nurses. So, he is not sticking on to the hospital policies, rules, or regulations. He is only cared about the patients who are being admitted due to COVID 19. So, he is not a bureaucratic leader. And option C is transformational leader. A transformational leader always shares his knowledge to the subordinates. He always inspires his subordinates so that they will also improve their skill and knowledge. So, how should a leader shares his knowledge? They should involve their subordinates in the discussion. You understand? I hope you understand well. So, a transformation leader is a person who transforms his knowledge and suggestions to their subordinates. So, they will involve their subordinates in the discussion so that they will gain their knowledge, and so that the management will come to a proper decision by consulting with them also. Okay. And option D is transactional. A transactional leader always relies upon rewards and punishments. If their subordinates gives a positive outcome, he or she will give a reward, or if the subordinates gives a negative outcome, they will give punishment. That is what a transactional leadership is. He always sets a target, and those who accomplish the targets will get reward, and those who not will be punished. That is the character of a transactional leader. So by describing all these leadership, the correct answer is option C, a transformational leader who always shares their knowledge and involves their subordinates in the discussion so that they also will improve their knowledge and skills. So since transactional leader relies on rewards and punishment, and autocratic leader is a leader who makes his own decisions without consulting any subordinates, and bureaucratic leader is a person who just sticks to the organizational policies no matter what the emergency condition is. The answer becomes option C, which is transformational leader or transformational organization. This can also come under another category of leadership, which is democratic leader. A democratic leader is a leader who involves their subordinates in decision making. Only after consulting with the subordinates, democratic leader makes the decision. In the same way, transformational leader also includes their subordinates in the discussion so that they will come to a decision. Moreover, their subordinates will also gain something from their discussion. That is what a transformational leader is. So, from the given options, the most suitable answer is transformational leader or transformational organization. Okay. Next question. A nurse gives antibiotics without the patient's consent or wishes. What legal issue does this represent? Options are A. Battery, B. Assault, C. Negligence, and D. Malpractice. So, before coming to the question, I will explain what the options really means. So, coming to option D, malpractice. Malpractice, in simple words, means it's a professional negligence. So, I will explain what malpractice actually is. If a professional person does something, means if a professional person gives a care which leads to complication of a person, or it is a mistake conducted by a professional person while giving care that results in an injury or harm to the patient, that is malpractice. Okay. And negligence is mostly done by a non-professional person, but what it means is forgetting to give the care which result in injury to the patient. So it's avoiding a patient or forgetting to give the care to a patient which results in complication or injury or harm to the patient. And B is assault. Assault is any actions or activities that increases the anxiety of a person. For example, threatening or shouting to a person. So if a patient says, "I don't want this medication," and the nurse says, "If you don't take this medication, I will lock you inside the room, or I will not give you the food." These are all the examples of assault. Okay. Negligence is forgetting to give the care. For example, if a nurse forgets to give a dose of medication to a patient, okay, mostly negligence is done by a non-professional person, but it can come under nursing profession also. Malpractice is purely by a medical professional. Mal means abnormal and practice means care. So malpractice is mistake in the care which result in injury to the patient. Okay. And last is A option, battery. Battery means forceful touching, forcefully touching the body of a person. Intentional and forcefully touching the body of a person without their permission. That is battery. Okay. So coming to the question, the nurse gives antibiotics without patient's consent or wishes. So what legal issue does this represent? So I have already explained all definitions of the four options. So after defining all these four options, I hope you have come to a conclusion. Now I will tell the answer. Answer is option A, battery. So I will repeat what is battery. It is intentional and forceful touch to the body of a person without their permission. So it is clearly mentioned in the question that nurse give antibiotics without the patient's consent. It also includes many other examples like restraining the patient, beating a person or patient, even conducting a procedure without consent comes under the category of battery, because that is also touching the patient without their consent. So, answer is option A, battery. Okay. So, these are some of the questions which comes to the exam for Oman Pearson Vue exams. I hope you all like the video. If you like the video, please like it and subscribe it. We will soon see you with a lot more questions regarding Oman Pearson View exams. Thank you. And if you want to know more about our classes, just like I said in the beginning, please contact us. Okay.